Hello, welcome to another Real Raw Moment. And today's is, I'm not even going to say here. I want you to get this stuff out of the way and then we're going to dive right into it because once I start talking about it, I'm not going to stop. But before I start talking about that, let's talk about what I am not. I am not a doctor, lawyer, therapist, or any other accredited body that can be used to fight your case or to guide you in any sort of medical decisions. I am merely a two-time alienated parent, a person who has experienced multiple types of abuse. I've been in the court system longer than I care to think about, and I believe that if I'm thinking it, feeling it, or wanting to know about it, I'm not the only one because I'm not that unique. So I come onto these videos, my real raw moments, to talk about them. As the internet says, for entertainment and information purposes only. Okay, whew, here we go. I'm going to talk about something that is alarming. So buckle up because it is alarming. And that is why I'm going to term as medical alienation with our children, with our alienated children. Now, that's not even a term because I've not come across a term for it yet, but it's something I want to get going within the medical community and the legal community to start solving these issues. And the issue is this. I am coming across and experiencing one-on-one with people, alienated parents of all ranges of alienation, that their alienated children are being denied medical care, necessary medical care, not only just regular medical care, but necessary medical care, because the alienator, the core alienator, or the alienating parties basically want to do whatever the alienated parent, the opposite of what they want to do. They say the alienated parent says that there's this diagnosis, they need this kind of care. The core alienator is saying, no, they don't, you're lying, etc., etc. I am seeing it at an alarming rate in real time, real form. And this week, I have dealt with it with 8 different cases. When I say cases, again, these are my real raw moments. So I'll say instances because I'm not a therapist or doctor, lawyer, or anybody else, right? Cases is just a word. It doesn't mean I'm operating in a professional capacity. In conversations where these alienated people, parents, caregivers, are having doctor's appointments canceled, necessary treatment doctor appointments canceled, just so that they can't attend. They're seeing their children denied necessary medical care because the alienator, the other parties, don't want them to be part of the child's life. This person, these people could take these children to appointments, necessary appointments, and they're being denied access. And by being denied access, they're being denied being a part of their child's necessary medical care. Now, I want to be clear here. I'm not talking about facials. I'm not talking about time. I'm talking about real medical stuff, diagnosed instances where a child needs care and it's being withheld in order to basically piss off the targeted parent or person. Can you tell I'm fired up about it? Can you tell? Ironically or fortuitously, as you know, I tend to believe the universe kind of brings me things at the right time to talk about it. I've been thinking about this topic for quite a while, and I've got something here just looking down my phone because this alarmed me, and this is what prompted me actually to do this video today, right now, in this moment. A little bit more off the cuff than I would. A lot of times I would have actually brought a little case law into this or examples of things in court or something to fight it, to give you a little bit more kind of oomph with it. But this typified exactly what I'm talking about. So this comment is in a group that I'm in. It's a very large group. Person who runs it, I respect very much. And I do not respect them less because of what this comment is. This comment is made by a person whose name I've known for a long time. I can't say that I've met them. I maybe crossed paths through comments, but they're known to me by name, on site by name. That's it. And there's a post, a quote that says, "Children thrive when they have schedules, family meals, structure, and routine. Good habits start at home." Okay, I think we can all agree with that as parents, right? We hope. And what we see in alienation often is the destruction of any sort of structure or, normal life for our alienated children. Now, you know what? If you're an alienator out there, you're chirping about this, oh, do I want to talk to you? Comment below. I'm not afraid to face off with anybody. And in fact, I would love to have conversations with people who are the alienating parties but think that they're not the alienating party and have comments about this, because I know that they do. And here's a great example of a comment that was made, the first comment that was made on this post, which is a very, to me, yeah, kids need structure, right? Kids need to go to school. They need to know their meal times. They need structure is safety. Routine is safety for children. I almost don't want to read it because it just, I preface this like I'm shocked. I'm shocked and disheartened. They also thrive without vaccinations and doctors. Okay. Say that again. They also thrive without vaccinations and doctors. Now, if we have learned anything from 2020, talking about vaccines is off the table. I'm certainly not touching that topic. Everyone can make their own medical choices as far as let's call it regular maintenance, I guess. Not even that, because I advocate for regular maintenance for their children, seeing a doctor in an appropriate time frame through growth and everything. That's partly what this video is about. So I don't want to negate what I'm saying. When it comes to vaxes, I'm out. That's very, very, very personal and controversial. That's not what this is about. I don't want to get clouded by it. So anybody who hears the word vaccination, last time you're going to hear it, we're moving on. We're moving on to the second part of the statement, which is, and doctors. Wow. You know, when people tell me things, as they often do when I'm coaching or doing support calls or even doing various volunteer work, there are times where I'm so floored, right? Like I'm like, I believe now, first of all, I never disbelieve what I'm told. It's just so far out of scope of normalcy, normal thinking, responsible parenting that, it's like, what, really? Like you question it. But this comment floored me. Children thrive without doctors. No, they don't. I'm going to tell you that right now. They don't. And here's why. Especially in today's society. And again, let's remember, these are my real world moments. I'm not a doctor, lawyer, therapist, or anybody else. This is my opinion. This is my opinion based on raising children. It's my opinion based on being through my own medical trauma and my own journeys through medicine. Some positive, some really negative. Children don't thrive without regular medical care. Now, perhaps this person stating it's about vaccinations, they feel that doctors are going to push vaccinations on and therefore no doctors. Well, a doctor can recommend whatever they want. They can't force you to do anything. And maybe that's even part of the problem, which is what I want to talk about today. But if there's one person out there saying it online, you know that there's other people thinking it and feeling it. And I don't get it. Like, I want comments on this. I don't get it. I don't understand when a child has a medical need. Let's even just put aside regular maintenance, like not going to the dentist every 6 months or every year, depending on what you can afford, or even every 2 years, depending on what you can afford. Listen, life is expensive. I get, things like dentistry can be seen as like a luxury thing to pull back on. I'm not here to judge or to speak to that. I don't understand. In a case where a child has a diagnosed medical condition and is having a routine, a regimen, treatment set up by specialists and saying this child needs to attend these appointments with these treatments in order to manage their condition. And we're not talking cures here, we're talking condition management. And there's a parent out there saying no. Not only saying no, but there's parents out there saying, well, sure, when I can take them. Even if the other parent's saying, I'm willing to take them. And even if the child, shocking, is willing to go with that parent. In alienation, again, I've talked about the degrees of alienation. I'm going to kind of define that in another video. But just because there's alienation going on does not mean the child does not want to see the other parent. Right? Let's remember what the definition of alienation is the denigration, the bad mouthing by one parent to another parent to to basically pull that child into their corner and turn them against the other parent. That's a very simple explanation for it. But I don't understand this. And I'm hoping in this video, in the comments, I'm going to reach out to some medical people. I want medical people, doctors, let's comment on this. Let's talk about it. What can be done? The second, even possibly more appalling aspect is exactly that, what can be done. Now, you would think that this is negligence, right? On the part of the parent who's not willing to take them to the appointments, ignoring them, fighting, whatever. I can't go into all the things. If you know, you know. I hope you don't, but if you do, and I'm finding out a lot more people do, comment below, subscribe, forward, get comments. I don't get it. I just went off on like a trauma brain there. I forgot what I was saying. Happens. This happens in trauma. This is very normal. If it happens to you, take a deep breath and reset. And that's exactly what I'm going to do. I was going somewhere good, so hopefully someone picks up the thread in comments below. Because again, these are one take. I don't redo them. So it's just, goes with the flow here. Negligence, that's what it was. It's medical negligence, right? Is this not considered a form of child abuse? To withhold care to a child that medically is determined to need it? Yes. If you're not out there saying yes, I want to know why. And if you are, I also want to know why. But I'm saying yes. How I would view it for my own children, absolutely wouldn't stand for it. Don't want to stand for it. And yet, I'm watching these parents freaking fight. Go to the police. Go to your CAS, your CYS, CAFCAS, whomever you have, your governing body for child welfare, only to be told either there's nothing they can do, it's not that bad, it's that parent's right to decide. I'm sorry. No, actually, it's not. Being a parent doesn't make you God. This is a privilege to be a parent. It's a very high honor, high-seated position in life. You have the care of another human being in a way that nobody else on earth does, especially for a mother and a father, primarily. The primary two parents. So how is this not child abuse? How is this not medical negligence? Comment below. I want to know. I'm doing this video not because I actually have an answer or even necessarily a recommendation. I'm looking for them. I'm looking for lawyers and doctors to tell me what's up here. Give me the good word and say, well, Natalie, because I can tell you, correct me if I'm wrong, I don't think anybody can look anyone in the face and say, oh yeah, that, sure. Right? That's fine. Yeah. They don't need that treatment unless I feel like taking them and, oh, you're offering to help and you're offering a way to do it? No, because I don't like you. I'm pissed off at you. You're my enemy, my ex, whatever. Right? There are attitudes, emotions, and egos getting in the way of children's fundamental rights on all levels. I mean, don't even get me started there. But wheeling it back in around medical care. We can't stand for this. We, the collective, parents, lawyers, doctors, like what the fuck, everybody? Just gonna say it. Enough is enough. So as always, I keep these under 15 minutes. We're gonna wrap it up here. I could go on all day. Comment below. Forward this video. Ask for answers. Let's find answers. Let's find reasons. Let's find case law. Let's find ways to get our children the help that they deserve, they need, the care that they are entitled to on a basic human level right, and certainly those children who are diagnosed with a medical condition. If a child was diagnosed with cancer, yeah, I said it, would any parent withhold care? Highly unlikely. So why is any other diagnosis different to their care, to their needs, to their well-being, to their overall health? It's not. Change my mind and comment below.